Okay, good afternoon, everyone. We continue with the visual diagnosis sa Shen vitality, the clinical manifestations. So, clinically, spirit can be manifested as having spirit, fatigue spirit, and lack of spirit, which can be further divided into subcategories based on the severity of the lack of spirit. These categories include loss of spirit, false spirit, and spirit disturbance. First, having spirit. Sa definition, the normal physiological state when the patient is full of vigor, reflected in a sufficiency of both essence and chi. Sa manifestation, the patient is alert with bright and vivid eyes, clear consciousness and speech, quick responses, resonant voice, radiant complexion with natural expressions, and a freely movable and flexible body. So indication the patient's essence has not been exhausted and the condition of the sangfu organs has not fallen into severe disorder, even though there may be illness. Sa clinical significance, the illness is not serious and the prognosis is favorable. Second is fatigue spirit. So definition, a mild manifestation of lacking spirit, fatigue spirit, and lacking spirit differ only in degree of severity. Fatigue spirit is between having spirit and lacking spirit. Sa manifestation, there is restlessness, lassitude, poor memory, weak and low voice, aversion to speaking, fatigue, slow and awkward actions. The main symptoms of fatigue spirit is poor memory. Sa indication, there is deficiency pattern usually caused by heart and spleen deficiency or kidney yang deficiency. Sa clinical significance, allows one to judge whether the state of chi is in a state of excess or deficiency. Next, we go to the lack of spirit. A pathological state wherein deficiencies or disturbances undermine the calm or fullness of the spirit, which manifest in any of the presentations. First, letter A, loss of spirit. Sa definition, the patient's loss of spirit which reflects an exhaustion of the essence, deficiency of chi, and weakness of vitality. Sa manifestation, patient has dull eyes, slow and awkward action, blurred vision, dull complexion, and facial expression, heaviness of the body, obtuse action and responses, mental confusion, or even unconsciousness, delirium, and hallucinations. Sa indication, patient's chi has been exhausted, essence has declined, functional activities are insufficient, and the disease is severe. Sa clinical significance, the disease is severe and the prognosis is unfavorable. Next is the false spirit. It is the apparent indication of improvement in which the patient suddenly improves during the terminal stage when the patient's essence and chi are extremely debilitated because of the chronic disease or serious illness. The sudden appearance of apparent health is a transitory state that precedes death of the patient. Okay, yun po yung false spirit. Sa manifestation, the extremely weak patient in a critical condition is listless, unconscious, with dull eyes, has dislikes of speaking, low and feeble voice, dull complexion, and anorexia. Yet the patient suddenly feels better, has clear consciousness, bright eyes, louder voice, flushed cheeks, and improved appetite. Indication, exhaustion of antipathogenic chi and impending failure of yin and yang, in which yin fails to restrain yang, and the yang is separating from the yin. Sa clinical significance, there is an imminent death. So, yan po yung pag naka-observe ng false spirit. Next is the spirit disturbance. The spirit disturbance is also a manifestation manifestation of lack of spirit, but the pathogenesis is totally different from the type caused by essence, blood, or antipathogenic Qi exhaustion. The spirit disturbance means that consciousness is obscured or lost. This condition is usually found in one of the following patterns. These patterns are caused by unique etiologies and pathogenesis. Although these patterns are manifestations of lack of spirit, they are not necessarily critical conditions. First, irritability and restlessness. Yung symptoms, irritability, restlessness, hot and heavy sensation in the chest, feverish sensation, and irritability causes the patient to prefer nudity and even drives the patient to jump into the water. Sa pathogenesis, pathogenic heat in the heart, lungs, or kidney. Next is restless organ disorder. Yung symptoms, there is mental depression, possible hallucinations, disorientation, frequent attack of melancholy and crying spells, frequent bouts of yawning, no loss of consciousness. Sa pathogenesis, there is heart and liver blood deficiency. Next is hysteria. The symptoms, there is chronic depression, apathy with aversion to speaking, mumbling to oneself, insomnia, there is anorexia, there is sleepwalking. Sa pathogenesis, there is heart and lung yin deficiency. Next, we go to the yin madness. Ang symptoms, there is chronic depression, there is aversion to speaking or mumbling to oneself, laughing or crying inappropriately. Sa pathogenesis, stagnant phlegm, misting the heart orifices, or spleen and heart deficiency. Next is yang madness. Yung symptoms, raving with obscenities, madness and restlessness, singing loudly and favoring high places, wandering naked, hitting people or destroying things. Sa pathogenesis, phlegm, fire, disturbing the mind. Next is epilepsy. Symptoms is sudden syncope with drooling, saliva, and spasm of the limbs. There is a short blackout or period of confused memory and changes in the way things look, sound, smell, or feel. After the symptoms pass, the patient manifests no abnormality. Sa pathogenesis, liver wind with phlegm or phlegm fire disturbing the heart. Okay, sa comparison of having spirit, loss of spirit, and false spirit. Sa complexion, sa having spirit, there is bright hues and moist skin. Sa lost spirit, there is dim hues and dull skin. Sa false spirit, dull skin with sudden flushed cheeks. Sa eyes, having spirit, there is alertness, vivid colors, twinkling eyes. Sa lost spirit, there is dull colors with blurred vision. Sa false spirit, there's dull colors but suddenly lustrous. Sa mental status, having spirit, there is clear speech and consciousness and agile responses. Sa loss of spirit, there is unconsciousness or delirium. Sa false spirit, there is unclear consciousness with sudden change for the better. Motion and response, having spirit, freely movable, there is quick responses. Sa loss of spirit, slow movements and responses. Sa false spirit, there is suddenly responsiveness. And sa respiration naman, having spirit, it is even. Sa loss of spirit, it is rapid, feeble, or with difficulty. And sa false spirit, it is feeble, but suddenly strengthening. Sa diet, yung having spirit is good, poor naman sa lost spirit, and sa false spirit, it is poor but suddenly improving. Okay? Sa summary of inspection of spirit, sa having spirit, it indicates sufficient essence, mild illness, and good prognosis. Sa fatigue spirit, It indicates a deficiency syndrome usually caused by heart and spleen or kidney yang deficiency. Sa lack of spirit, it is divided into three. Sa loss of spirit, which indicates exhausted essence, severe illness, and poor prognosis. Sa false spirit naman, it is a pseudo phenomenon, indicates crisis stage. Sa spirit disturbance, there is psychological and emotional disorders due to various etiologies and pathologies. Okay? So thank you for your attention.